Hello, everyone. Welcome to, I'm going to call this a special edition of 2-Minute Emergency. Now, today it's not going to be a 2-minute emergency because I have a special guest here, and we are going to be talking about eye safety. So July is Eye Safety Month. And so there are so many things that we have to be particularly conscious of when we're speaking of our eyes. So I have a very special guest here today, and her name is Dr. Charlotte Akor. She goes by Dr. Charlotte. So Dr. Charlotte is a fellowship-trained pediatric ophthalmologist here in Texas who sees both adults and children. Now, she is also a medical billing and coding expert, and she helps teach physicians how to enhance their practices through proper medical billing and coding. And Dr. Charlotte is also a 2-time best-selling author, and she's a mother of 2. So please join me in welcoming Dr. Charlotte.
Hi, Dr. Leslie. How are you doing?
I am doing wonderfully. I'm so glad to have you here today.
Oh, thank you for having me.
So I know that you have a ton of information. You've been practicing this specialty for how long?
15, 16 years.
Wow, time flies, right?
Right?
All right. And Dr. Charlotte is at the end of a busy day. She had clinic all day today. So she's been seeing the little ones and adults all day long. And we appreciate that. So, Dr. Charlotte, tell me a little bit about your practice. What do you normally deal with on a regular basis?
So the bulk of pediatric ophthalmology or caring for a child's eyes is one, are they seeing well, right? They can't communicate with us. Hey, mom, is my vision's blurry. Some kids can say that, but they don't usually say that. So that's why the pediatrician actually screens the children. So your child should have their first attempt to read the eye chart, usually around 4. That's the national recommendations. But there are actually some special machines that take a picture of the back of the eye that will show if a child has a refractive error. So that's pretty cool. Sometimes I end up checking 18-month-olds because a daycare may get that machine.
Oh, wow. So it's a machine that they can actually get themselves? They don't have to come to your office?
Right. So it's screening. So there's so many children, right? And there are a lot of children that have normal eyes, but we still want to find that subset of children who need glasses because visual development starts in childhood. And if your child doesn't have the proper pair of glasses at times, they may not be able to gain good vision when they're adults. So one of the most important things or part of what healthcare does for children is screen their eyes because they may have one eye that's perfect 20/20 and one that sees 2100, but if they don't talk or if they're 2 or they're 3 or they're 4, they're not going to be able to say, hey mom, this eye sees perfectly, this one doesn't. So that's a large part of pediatric ophthalmology. And another part of pediatric ophthalmology is misaligned eyes. So children who have eyes that turn in, children who have eyes that turn out, children who have eyes that go up and down. But esotropia is the name of the eyes that turn in, and exotropia is the name of the eyes that go out. But the reason why we're so concerned about that is that can cause vision loss too. So the child's brain doesn't want to see too. So the eye that's misaligned, the brain will shut off the eye. And then I deal with a bump on the eye, and a few miscellaneous things, but the serious things I take care of are the strabismus and making sure a child can see well.
All right. Well, Dr. Lakeisha is here. Thank you so much for joining us, Dr. Lakeisha. So we are talking about eye safety, as this is Eye Safety Month. So what is the most common injury? Now, I know you don't see those little things that heal easily. I see in the emergency department, I see things like minor corneal abrasions if a child scratches their eye accidentally or something like that. That stuff doesn't come to you. So what kind of injuries do you see in children particularly?
So probably some of the biggest, I've seen, being a pediatric ophthalmologist for a long time, I have seen anything that can go in the eye. So I had the opportunity to work at a busy trauma center at the University of Texas at Houston. And if you could tell me an Easter basket could pierce the eye and cause an open globe, a Barbie hand that could pierce an eye and cause an open globe, any toy, if you use the sharp surface, can damage an eye. The other thing that say it's easy to prevent, right? Because you're not going to tell your daughter to start wearing safety glasses so the Barbie hand doesn't poke them in the eye, but special guns. So the thing that I've seen that could be preventable are guns, so airsoft guns. So if an airsoft gun goes off close to the eye, it won't cause an open globe, but that pressure of that ball against the eye can actually cause bleeding in the eye and cause tearing of the iris, the colored part of the eye. So, when there's some sort of BB gun, airsoft gun, if someone asks me, hey, list the toys that are dangerous, I've seen all dangerous toys. I mean, how can Easter be dangerous? But it is. But if you had to say, Dr. Charlotte, which toy would you say is dangerous? And I would say BB guns, airsoft guns. That would be the toy that I would have my child, one, probably not play with them, because things happen with kids so fast, right? They take those safety glasses off, and then the one little boy gets next to the other little boy, and that's where it's happens, right? We can't regulate play on how close kids get to each other. But I've seen it all. I've seen, a young girl or young boy hit his sister with a golf club in the eye. I mean, however you could imagine trauma happening to a child's eye, I've seen it. So
you've seen it all.
So if I had to encourage parents to be safe, or not even bring that, toy into their child's home, you have to be careful with BB guns. You have to be careful with airsoft guns.
Absolutely. One of the things that I noticed, which is a good thing, is when I was growing up, there were a lot of kids that had dartboards too. And fortunately, the ones that we see now, they switched more to the suction cup ones. So I'm glad that's one less potential injury out there. So for kids, how do we protect their eyes? I mean, it's kind of hard to tell your little one to wear goggles all the time, safety goggles. One, as you said, they're going to take them off the first chance they get. And B, the other kids aren't wearing them, Mom. I really don't want to wear these. So are there any good solutions?
No, not really. Just a little bit of prayer, and really limiting the use of those toys, or have supervised use, because we're in the Google world, right? So you can Google airsoft gun injuries. You can have injuries and people can recover, but if you review the literature of things that are difficult to recover from, that's one of the injuries, right? We're in a society where we can do the research, and the research says, airsoft guns, BB guns. And so one thing is, the children who actually have to wear glasses, they're lucky, right? Because they have protection on their eye. Instead, if an elbow comes into their eye from playing basketball, then hey, at least the glass, or not the glass. Glasses aren't made out of glass, but the polycarbonate or the structure of the lens impacts things first, right? So that's why glasses are so important. And one thing that I tell my parents, especially if a child has already lost their vision from one eye, so the things that I told you about, like, and a difference between the vision between the two eyes can cause blindness. Misalignment of the eyes can cause blindness. So if a parent has a child that already has one blind eye, they have to be even more diligent, because some of those diseases that start in childhood that we cannot rehabilitate, their child only has one eye, and that's their moneymaker. I say that's your moneymaker. That eye is going to drive your child to work someday, right? That eye is going to, determine if your child can read on their job. So they can't be reckless and not wear the glasses and protect the one eye that their child has.
Absolutely. And one of the things that you mentioned was that glasses aren't made of glass. However, glasses are not the same as safety glasses either, because they can shatter in some cases, depending on, I should say more sunglasses than glasses. So people who throw those sunglasses on and think, oh, I'm being protected, they're not the same as safety glasses, right?
So when it's usually an industry standard, but when ophthalmologist or an optometrist writes glasses for a child under age 14, they're usually filled with polycarbonate. So polycarbonate is a shatter-proof lens. So if something would hit the polycarbonate, the lens would pop out instead of breaking into pieces. So once a child is over that threshold or whatever the industry standard is, and they have one eye, I recommend and write on the glasses script, make sure this is filled with polycarbonate, because polycarbonate, the whole lens will pop out with an error instead of, like you said, break into pieces. And what you said, you're right. Regular glasses is different from safety glasses. However, most injuries come head on. So I think just even having regular glasses on is great. Sometimes there are things that can go up and under the lens, and they do, but I don't think it's as common, right? So people who wear glasses are used to wearing glasses, and the people who don't, it's hard to say, hey, am I gonna pick up and get my safety glasses to cut my grass or do my welding or, hammer a little bit of metal. And so you, as an ER doctor, I'm sure you see a lot of metal in the eye. You see welding burns, and, I get them when they don't go away very easily, or they don't heal as fast as they should.
Absolutely. And Dr. Lakeisha said she's always been so nervous about her kids having an eye injury when they were younger. So I think it's every parent's fear that something's going to happen to their child's eyes. And Karen, thank you so much for joining us. She says, great information. Our pleasure in sharing it with you. So you mentioned, Dr. Charlotte, as far as people who aren't used to wearing glasses and their safety glasses and welding helmets, etc., when they're at work. So I see far too many people, usually at work, because they have those standards, they have to wear them. Otherwise, their boss comes down on them. But at home is most of the problem. So people take their skills from work at home and have all these wonderful DIY projects, which is great, but they forget about the safety because they're not in that same environment. And so I see a lot of people, most of the time it's pretty benign. People get, little fragments of wood if they're doing some sawing and things like that. But every once in a while, you get those major injuries. So one of the things we always worry about, nail guns. Nail guns are scary.
Yeah, I've had one of those too. Like I said, I've been in practice for a while. So I was thinking of my favorite injury with the fishing hook, but I have seen a nail gun to an eye that being repaired, the person, did not regain their vision, because the eye is a very soft tissue, a very delicate tissue. And I say it's like Humpty Dumpty. You can't always put Humpty Dumpty back together again. So it's better to, make sure Humpty Dumpty doesn't get injured. But I've seen some serious injuries. I have seen a nail gun injury. I have seen a fishing hook injury, and it really depends on, where in the eye that is injured. So the cornea is the clear part of the eye, but that, I mean, if I'm I love science. I'm just amazed how, God made the eye so beautifully and the cornea and how just the cells go together to make that clear cap of the eye. And so when it's, when it's disrupted, we can put it back together again. It causes scarring. There's no way to, um, you can see where someone has had an injury or where the cornea has separated, because we sew it back together with sutures. And then, how deep does it go? So the lens, that clear part of our eye that's responsible to help us focus in, it's born clear, and it's held in a little capsule. And when that capsule is violated, it goes cloudy. So I've seen someone who's had an injury. It can be anything that, just as a small piece of wood, a small piece of metal that touches that lens, that violates that capsule. I've seen somebody form a cataract in 2 days from that. Like, hey, I saw them in the emergency room and it was just a little bit cloudy. I was like, oh, something happened here, but I'm not going to go do something because there's inflammation. And then 2 days later, I know that capsule's been violated, and now it's a white cataract, a traumatic cataract, as we call it. And then behind the lens, behind the clear part of the eye, is your vitreous jelly, and then your retina, the part of the brain part of your eye that is responsible for seeing. And when that gets injured, there's no good part of your eye to injure. But I do have to tell you that the patient that I took care of recently with the traumatic cataract, he actually did very well. Whatever the injury mechanism, went through the cornea pretty clear, hit that lens. But I referred him out to a colleague to get his cataract removed, and he ended up doing well. But, every part of the eye just has such a special makeup, and it's hard to, we haven't figured out how to reproduce that makeup. And really the extent of the injury determines how well someone will be able to recover and see again.
Well, Dr. Lakeisha actually said she's had 2 corneal abrasions in her life. She said the first one, she was young, and her was a big, reached out and scratched her cornea. And the second time, she was an adult, and she got a splinter in her cornea. And she said that was really a freak accident.
Yeah.
So that's what usually happens. I mean, by definition, these are all accidents, and we do our best to avoid them, but sometimes they are unavoidable. Now, I thought of something else, and there are a couple of things that I want you to tell me. Is this myth or not? So one of the things people say is, well, you can damage your eyes when you're young, or when you repeatedly cross your eyes. Is that true? Can you damage your eye?
No, that's myth. So that's myth. Okay. Myth. Yes, and so it is cute when kids do that, but the ophthalmologist I am, I can pick out the ones that are playing games. So,
all right. Now here's another one. So growing up, parents used to tell you, don't sit too close to the television because you're going to damage your eyes. Well, the televisions that I grew up with are slightly different from the televisions today. But is that true?
So no, your need for glasses or your refractive error is going to be whatever it's going to be, right? And if you were a child, and even me as an adult, I like to get close to the TV. I like to be in the TV, right? You get a better experience if you're close to the noise. However, if a parent puts their child back and they really object, then it may be worth asking that pediatrician for the screening. So pediatricians are prepared to do that. I mean, pediatricians are such an integral part of helping children to see, because there are so many children and there's not as many pediatric ophthalmologists or ophthalmologists. So babies are screened from when they're born. So as soon as they are in the newborn nursery, day one, the pediatrician is looking for the red reflex of the baby. So there are some serious conditions that are, if they aren't recognized early, if they're present early and they're not recognized, if they're present and not treated early, it can cause long-term blindness, and there's nothing that can be done. So it's essential that a baby has that newborn exam in the nursery, and what the pediatrician is checking for is to make sure the child has a red reflex, and so that if a child does not have a red reflex, then it can be a sign of a cataract, and if there is an occlusion of the lens, the brain basically just shuts that eye off. So it's so important that the pediatrician and that parents keep up with their pediatric appointments. So the pediatrician's looking at the eyes at that 2-month visit, that 4-month visit, that 6-month visit. They are, they are looking out for your child's eyes, and when they notice something abnormal, they're letting the pediatric ophthalmologist know. But it's also critical for the parent to screen their child, right? So the parent to say, hey, I just, something's not quite right. Jessica isn't the same as Johnny. I feel that she's squinting more. I feel like she is getting close to the TV, and when I pull her back, she won't get back. Or I have a strong family history of glasses wear. I have a funny story to share. I did a screening at a expectant mom's conference, and I felt like all the people with glasses walk the farthest away from my table. As a doctor, there's genetics, right? There may be a whole family of people wearing glasses. So if everybody in your family wears glasses, you may want to get your child checked out too. As soon as my sister came out, we got her checked too, right? Her refractive area isn't as severe as my mom's, my dad's, and my sister's. But if you know that there's a strong propensity for people to wear glasses in your family, it's better. I tell people it's better to be safe than sorry. Find out, right? You don't want to wait till they're 4 or 5 when they start reading the chart at the pediatrician, where you had a hunch when they could have been wearing glasses when they're 2.
That's right. Because you don't want to stifle their learning, their development, because they don't have proper vision. So. Now, I have another one for you. Now, this one I think might be true. So we see those good old laser pointers, and it's fun to play with the cat, and the cat will chase the laser pointer around. But what I heard is that if you flash a laser in someone's eyes, specifically some of them with that are more towards the green and blue spectrum, that you can actually cause damage to the retina. Not just for a second, but if you put it in someone's eyes. Is that true?
Yes, that's true. And it's also true if you stare at the sun. So there's an entity called solar retinopathy. So you just staring at the sun, that sun's energy can basically burn the retina and cause the tissue. So yes.
So you heard it first. Dr. Charlotte gave you the information on what is true and what is false. So please keep all of these suggestions in mind. Now, one thing that I do too in the emergency department, and most people don't think about this, if someone comes in with an eye injury, we always make sure that they're up to date on their tetanus immunization or vaccination. And one of the things is, yes, you can get tetanus through the eye, especially if you're talking about metal particles and things like that. But we also use it as kind of a cheat way. I'll say that, because you're going to remember when you had that eye injury. People may not remember when they had that cut on their arm. How many years ago was that I got stitches, whatever. But if someone had an injury to their eye, they're going to remember it. And so we want to make sure that they're always up to date on their tetanus so that they don't have that added problem.
Okay. Yeah. So some ways I get histories from family members and say, hey, can you show me your child's baby picture? Can you show me your high school picture? Do you, like you said, do you remember? What did your mom tell you? Did you have an accident? So sometimes I meet people when they're adults, right? And not every adult remembers their complete eye history. So I have to play 20 questions. Did you remember that eye being weaker? When ophthalmologist checks someone's vision, it's one moment in time. But there are these childhood illnesses or childhood eye problems, like I just told you about, strabismus or a cataract, that even if treated, cause their vision to be decreased. And so if I talk to you, Dr. Leslie, the ER doctor, and you say, well, this patient's vision is 2100, is that patient's vision decreased because it just happened because of the trauma? Or were they always 2100 and that's just who they are? So, as a medical doctor, taking the history is so important. And we want to understand and tell patients, hey, this is why your vision is that way. One falsehood that when I have children, that it is difficult to make their vision better. Their parents always want to say, well, is there something we can fix later with laser, or can this get better later? And the answer really is no. That making sure a child's eyes in childhood, that they see well in childhood, is the best way for them to have good vision in adulthood. And the earlier they have problems, meaning 2 months, 4 months, 6 months, a year or two of age, when these problems start, they really have to be treated young. They really have to be treated young so they have good eyes for adulthood. And
I think you froze for a moment. Oh,
yeah.
I got you back.
Yeah, sorry. I said whatever vision a child has by age 9 is what they have and what they lock in. Now, that's not essentially true. Now, some children who have that amblyopia, that vision loss because of a difference in glasses prescription or misaligned eyes, there's studies that showed that they can be patched up until age 15 and it can be better. But like I said, there's a reason why the pediatrician is screening the child the moment they come out of the womb. There's a reason why, they're doing vision screens, at age 4. And then some places are getting the machine, at preschool. So it's so important that, before we worry about protecting the eye, and we should protect the eye, we make sure the eye that we have works. And so that's what's unique, I guess, about pediatric ophthalmology and childhood and vision development.
Well, I'm going to jump into one last thing because, as I said, Dr. Charlotte and I are both here in Texas. And so, as you can imagine, we have not only the summer heat, but we also have the bright sun. So when we talk about sunglasses can be worn by any age. Now, on kids, it's more like a fashion statement, looking cute for the younger ones. But we talk about the sun's rays, the UVA, the UVB. What do I need to look for in sunglasses?
I think, the ones that do the UVA, the UVB, that sounds good. But one thing that's very unique about sunglasses, well, sunglasses just help your eyes feel better, right? I mean, bright light, you want to squint, you want to close your eyes, but physiologically, your iris actually constricts, and the part of we call it the pupil, the void part of your eye, in between your iris, it actually gets smaller when when the light hits your eye. So, there is some thought that, hey, maybe the sunlight can actually lead to cataracts or, affect your retina. Really, the sun affects your retina if you're staring into it. But actually, the sunlight, and when you constrict your pupil, that's less light inside your eye. So, one, sunglasses probably help with comfort. Sunglasses help with protection, but it's probably not the end of the world if you don't wear them. And some people are just more light sensitive than others. We don't have a good reason why. I feel like you said in Texas, sometimes I feel like the sun is really, really bright. I definitely look for my sunglasses more than I did when I was doing my eye surgery training in Buffalo, New York. So,
you know what? I thought of one other thing that I wanted to mention as well. And that is something that we're all experiencing. I mean, right now, what are we doing? We're broadcasting this we're on our computers. So I had someone tell me that, well, first of all, we all stare at the computers far too long, but there's a 20-20-20 rule. And so that was every 20 minutes, you should take a break and look at least 20 feet away for 20 seconds, just to give your eye a break from the strain. Is that real?
Maybe yes and no. So what do your eyes do when you look? Are you looking at a computer? Well, you don't blink as much. You're concentrating. So when you're young, it probably doesn't matter as much. The child is so intrigued into their program, and youth is almost perfection. So when you're young, your windshield wiper is perfect. Your tear film is perfect. You can even if you're not blinking as much, the iPad is clear, the phone is clear. But what happens as you get older, your people get dry eye. So
Mm.
then if you have, a baseline decrease in tears, a mismatch of your tear film, then when you're, watching a screen, then you don't blink as much and you're more symptomatic. The other thing that exercise that you were referring to about taking a break and looking away is something that is associated with accommodation. So when you're young, everything is perfect. Your eyes can focus up close to see near, and then they can focus to see far away. But if there are some kids, so it's not as common in childhood, is that you have something what we call accommodative insufficiency. Basically, that mechanism to focus up close and far away, it's kind of off. But when you get older, and especially when you get in your late 30s or early 40s and on, those muscles that did make you superhuman, focusing up close, focusing far away, they don't work as well. So you can get that accommodative spasm that sounds like you're referring to. So yeah, that if you take a break from the computer, you're giving those muscles a break. That muscle's relaxing when you look far away because you're not using those accommodative muscles as much when you're looking far away.
All right. All right. Well, this has been a wealth of information. And Dr. Charlotte, I'm so glad that you were able to join me today and just share some of your knowledge with everyone. And so, with that, I am going to ask, is there some way that people can reach you if they would like to reach you?
Yes. So I'm going to look down on my phone. This is kind of odd, but I have a Facebook group for people who just want to be um, educated about um, eyes, like just uh, just to make so that hey, one thing about medicine is there's a lot of misinformation. So when I do talk to parents and patients, so if I encourage um, uh, parents to get additional information, but they should get additional information from someone who has the same level of knowledge, the same level of training, right? That you want to make sure that people do have the highest level of information. So I have as my mission to make sure that people have, accurate information about their eyes. And because the eye has so many pieces to it, and when I started studying about the eyes, it was like going to medical school again. So medical school, as doctors, we didn't know about the body. We really learned about the intricacies of the body. Each organ we studied for 8 to 10 weeks. But ophthalmology training is like that. We studied a certain amount of time for the cornea. We studied a certain amount of time for the retina. We studied a certain amount of time for the optic nerve, the cord from the brain. So it's not easily express to the layman, right? I mean, we like to make everything simple, but not everything is simple, right? And then there's that anxiety when sometimes a patient or a parent can't understand everything. So, what I've done in my Facebook group is I just share information about eye conditions, and I try to make sure that the correct information is put out there. And I encourage um, my patients, if they're nervous about surgery or they feel something's not quite right, to make sure they get a second opinion or an education from someone who has as much training as I do. So
Good.
the Facebook group is called it's called Through Their Eyes with Dr. Charlotte, the pediatric eye specialist. But if they type in "children see clearly," children, CHILDREN SEECLEARLY. So if you type in "children see clearly" on Facebook, they can join. Yeah, it's all one word, but they can join and just and learn information about eye things that they should be educated about, because that's my goal as a pediatric ophthalmologist, really to touch each of my patients' lives and help them see as clear as they can see.
All right. I'll put that up just for a moment. So we got that. That is on Facebook. That is Children See Clearly. And so you will be able to get more information from Dr. Charlotte and make sure your children have the best vision they can possibly have. So you can also find out more information, or you can share this very recording with your friends if you go to Dr. Leslie Sharp, either on Facebook or on YouTube. And you will find this video as well as my regularly broadcast 2-minute emergencies. And there is an entire library there about all different health topics, because I do my best to keep you healthy, safe, and out of the emergency room. And I'm Dr. Leslie, board-certified emergency physician, best-selling author, international speaker, and professional photographer. And I enjoy bringing you these tips and information. So please join us again and share this with a friend. Have a wonderful evening, Dr. Charlotte.
Thank you for having me.
My pleasure. Take care, everyone.